I got a message that said, Dr. Morris, what can I do about scoliosis? So it depends on your age, depends on the age of the patient. For me, I know that I have something called an MTHFR defect. It's a genetic defect. About 40%, 45% of the entire world's population has a genetic defect with the MTHFR gene, and it makes you susceptible to what are called midline defects. Midline defects are things like a hair lip or a cleft palate, pectus excavatum, or scoliosis. These are midline defects, and MTHFR genetic defects make you susceptible to those things. How do you handle them? You make sure you're getting enough folate in your diet or from supplementation. Now, be careful on this because people will tell you folic acid. Folic acid is synthetic, and folic acid is not well metabolized if you have an MTHFR gene defect. So first off, I have my children, for my kids, I want to make sure that they're getting enough folate as they're little because I know I have an MTHFR defect. My wife also has an MTHFR defect. So in order to keep my kids, their spinal cord, spinal column, and nervous system healthy, I need to make sure they have enough folate. Also, they need to make sure they have folate throughout the rest of their life as well. It's just the fact that they are likely to have that defect because we passed it on to them. Now, what about if you're already developed? What if you're past your teenage years and your spinal column is already developed? Well, then the things you could do for scoliosis would be to do chiropractic care, making sure your spine moves properly, and getting to a chiropractor who understands the scoliosis component and the misalignment component of how the vertebrae move and are aligned. Proper physical therapy, proper movement, exercise, stabilization exercises, functional movement evaluations, and functional movement exercises are really going to be helpful in this case. So if you have scoliosis, the number one thing I would tell somebody to do is make sure they're getting enough folate in their diet or take folate. The best form of folate is a methyl tetrahydrofolate. The next thing I would have somebody do is making sure they're taking good care of their spines, good spinal hygiene with chiropractic care, the right functional exercises, making sure that they're taking care of the whole musculoskeletal system. You don't want to end up needing a surgery because you had a scoliosis you could have done something about. Anyway, I hope you found this helpful. I'm Dr. Dave Morris with Magnolia Medical Center here in Murfreesboro, Tennessee. We do root cause functional medicine. We also do responsible pain management. We're here to get people well without the use of drugs and surgery and correct problems, not just manage them. Anyway, hit the like button, hit the share button, and hit the follow button. We really appreciate it.